Hi, William Stuart here, and I'm speaking to you from Las Vegas, Nevada, and I'm attending the North American Neuromodulation Society meeting, also known as NANS. It is the 16th annual meeting, and I'm thankful to be a part of this meeting in many ways, more than last year. It was a great meeting, great people speaking, great topics. I was fortunate to attend a lecture by Dr. David Caraway, and this was relating to best clinical practices, and his topic was intrathecal drug delivery systems, medication choices, medication dosing. And he's done a great overview regarding the current regimens of intrathecal drug delivery. I wanted to share with you some of the comments that he made to assist you in your practice. He said, "My practice and the way I treat my patients 20 years ago is different today than it was back then." And I liked it. It was candid, indicating change in decisions, change in our perspectives based on the knowledge that we have attained. He reviewed his pump practice and the way he approaches his patients and making the decision if they are optimal for implantable drug therapies. He reviewed systemic therapies versus intraspinal therapies and discussed the pros and cons of treating patients with traditional oral therapies versus intrathecal drug deliveries. He also reviewed the pain algorithms of the polyanalytic consensus guidelines. And it was interesting as he went through each guideline and showed how they differed, and then the ultimate 2012 guidelines. Did a great presentation of initiating drug therapy doses as well as looking at dosing ranges, and then also some of the new changes on the drug concentration limits that the guidelines have recommended. And then Dr. Caraway also addressed some of the issues of the recent publications by Medtronic regarding compounding medications versus utilizing FDA-approved medications for the treatment of pain. We respectfully are not in agreement with some of the findings for patients receiving non-FDA-approved infused drug formulations for the treatment of chronic pain. Compounded medications have been long tried and true for treating patients who have been retardant or resistant to traditional therapies and have received optimal outcomes in the relieving of their chronic pain. A lot of information discussed. This is pertinent information that needs to be rediscussed with clinicians. And again, I'm thankful to be a part of that and to hear this. I wanted to talk to you about one of the other lectures I attended regarding best clinical practices by Dr. Alain Magalanero. Great conversation. I've not heard this individual before, and he was talking about best practices regarding intrathecal drug delivery systems, and started kind of going through his algorithm. And one of them in particular was, doing patient selection, reviewing the patient, doing a historical, are they the right candidates for intrathecal drug deliveries? And then he started taking a look at some other things that I had not considered, and one of them was infection avoidance. And he said, you want to take a look at the candidate. Is there an infection going on? Kind of perform a history on this patient, do a physical exam. He talked about doing perioperative skin swab or also a nasal swab, seeing if they're basically carriers or do they have an infection on board that may impact implantation of an intrathecal drug delivery device. It was something that he put a lot of emphasis on is if they have an infection, hold off, treat the infection, and then proceed forward. And he said this was the greatest impact on decreasing ex-implantation and then reimplantation at a later time. He spoke of the pump location, which I thought was very interesting. He talked about doing an interview with the patient, talk to them, do an assessment of where would be the best placement of the pump, looking at asking the patient where is best comfort, assessing their weight and other conditions. There was something that I had never thought about was considering a suprafacial implantation or just below the skin, something I've never heard of before and that he felt strongly is actually an optimal consideration for a device implantation. He talked about catheter complications and kind of reviewed that subject of looking at microfractures, dislocation, securing the catheter location for infusion. Very interesting stuff, but I think these subjects they have been discussed over the years, but it's something that needs to be continually reviewed with with new pain physicians, as well as patients with extensive experience. Great presentation. I was unaware of this individual, and I thanked him for his lecture and the key points that he presented. This is William Stuart. Thank you for your time in this matter.
Hi, William Stuart here. I'm speaking to you from Long Beach, California. I have successfully recovered from a long trip in Las Vegas, and I want to do a follow-up regarding the NANS meeting. I gave you an initial report regarding some of the lectures going on, and I just want to do a follow-up and closure. I attended both the Saturday and Sunday lectures as well, and I felt very fortunate. On Saturday, there were some presentations by Dr. Tim Deere and Salim Hayek regarding pain management issues and issues relating to the polyanalalgesic consensus, the 2012. And Dr. Deere and Dr. Hayek kind of gave pros and cons of the new recommendation guidelines. And it was kind of interesting that the egos were in check again, and good information presented. At around noontime, there was a presentation to Dr. Joshua Prager, and he was given an award for a Distinguished Service Award. And Dr. David Cloth kind of did the intro and honoring Dr. Prager. A lot of interesting facts about Dr. Prager that I was unaware of, and his involvement in pain management. Truly a distinguished career, and he continues to be a presence and a driving force with interventional pain management. Dr. Prager gave a very nice congratulations presentation, and he reviewed images and people that had impacted his life and had advanced his knowledge and his career. And it was very gracious, and he was a humble person talking about those who had affected his career and his life. In the end, his wife and children were there to see him receive the award. He looked very proud. It was a neat moment for Dr. Prager, and I was glad to be a part of that. One of the last lectures that I listened to was something that was very stimulating to me and really just unique. There was a Dr. Kamal Kemali, and I believe he is from France, and he gave a presentation on music and the brain. And he was showing videos demonstrating how music affected people with neurological conditions and actually improved their conditions with music. Very, very unique. He played some music. He actually brought out an accomplished pianist named Presca Benoit, and she played 3 pieces, and very unique pieces, classicals, and they were moving. And so his presentation regarding treating people, specifically with neurological conditions, and showing an improvement in their quality of life. Very, very interesting presentation. In the end, I felt very fortunate to present myself at the NANS meeting, and Dr. Prager and I did a presentation on compounding issues, the quandary and relating to the recent accident and compounding errors. Gave a presentation regarding quality assurance, environmental monitoring, procedures for compounding pharmacies to conduct and to maintain high quality of their environments to provide quality pharmaceuticals. I was honored to be a part of the NANS meeting this year as faculty, and I look forward to next year. I recommend that all of you attend the NANS meeting next year. It will be a great meeting. This is William Stuart. Thank you for your time in this matter.